So, to get things started, are you aware that that the Cayce readings themselves, those 9,602 physical readings, those are the ones we actually have the transcripts for, 9,602 out of over 14,000, those physical readings, that as you try to read those, it makes a difference if you understand when he gave them and sort of the context. And because they can be confusing enough if you don't realize that. But if you realize that in that first period, that before he became a professional, before 1922, he was sort of giving them, initially just for friends and relatives. He was real hesitant to give the readings because he was concerned that he wasn't a medical doctor and someone might be harmed by this. And then as he went on, he got more positive feedback. But he was a photographer, and he was doing this and doing that. And then he had that stint where he went out looking for the oil out in Texas and Oklahoma and out through there. And then that sort of went bust, and that was a kind of a crucial period right there in about 1922. I can track it when I go back and I go on the CD and I put them in chronological orders, the physical readings, and how many readings per month, per year. And at 1922, I think it was about September or October, all of a sudden, 2 or 3 readings, 4 or 5 readings per month, physical readings, and then like 30 readings. And when I went back and read the reports, what I realized was he had given up his oil well drilling scheme. We've given up the rights, and at that point there was a conscious decision, I'm going to become a full-time medical intuitive. That's when he became a professional full-time. Up until then it was part-time and doing other things, photography and whatever his interests were and doing that. But there was a conscious choice, and you can tell just leading up to that a little bit, in a few months before that, and then especially in the few months that followed, his whole style of giving these physical readings changed very dramatically. Whereas the early period, he's very dependent on people asking him questions to keep the process going, and more of a kind of a hypnosis sort of thing where they had to sort of draw it from him and give him the suggestions for the information. And then after he became a professional, you could see that he starts organizing it. And he says, in the blood we find, in the nervous systems we find, in the functioning organs, and he would go from the head down on the functioning organs, and in the treatment plan, the question and answers, and so forth. So he started developing a format rather than these long, rambling sort of a little bit of this and a little bit of that, and depending on what kind of questions they ask, he actually took more of the initiative, if you want to put it that way. Now, I haven't figured out where that came from, but it's there in the middle period, and that's the format we're going to use for the most part today. We've tried to understand anatomy, physiology, and pathology, because that was from 1922 until about 1943, and that's when he started getting national recognition with the book, There's a River, and that magazine article that came out, and all of a sudden he's getting thousands of letters a day, and then he has to change his style again, because whereas this middle period, some of those he had plenty of time to give readings, so you find these nice long readings, lots of detail, rich in detail, talking about anatomy and physiology and explaining, going well beyond what he needed just to give the treatment plan. But after 1943, he's given, a few minutes of reading, and instead of 2 readings a day, 1 in the morning, 1 in the afternoon, he's going from 1 reading to the next reading to the next reading. He's cramming them all into one session. So then you just get the quick and dirty, so to speak. I mean, you find out instead of these nice long explanations of anatomy and physiology and pathology, he cuts right to the chase. Boom, here's what it is. Here's what you need to do about it. On to the next reading. Now, there's an advantage to that. If you want to find out what Cayce's approach is to a certain condition, like asthma or migraine, some of those best readings, just to get the concise version, what do they call it, sort of the Reader's Digest version of a condition, is just to go to one of those later readings and look at that, because there, in 2 or 3 paragraphs, he condenses it very nicely and says the essence of, here's what the essence of this problem is. And here's the essence of what you want to do about it. Or at this point in time, on to the next thing. So there, actually, the easiest readings to understand, if you're getting started and you want to understand the Cayce physical readings, is to go from 1943 to 1944, because that will focus you very quickly on what the issues are for most of these conditions. So we'll touch on that a little bit. But particularly this afternoon, or later in the day when we start focusing on diseases, you'll see more of those come through, because he really gives the essence of, in epilepsy, what's going on, in migraine, in asthma, what's going on.